Aboriginal and Torres Strait Islander viewers are advised that the following program contains images and voices of people who have died. The families of the deceased have granted permission for their names and faces to be shown in this program.
It's twilight in Doomadgee, in remote northwest Queensland Gulf country. The children have come out to play. They're joining in a medicine dance. Almost 40% of the people who live here are aged under 14 years old. Despite the joy in the children's faces, there's a sadness that runs through the heart of this place.
I'm tired of burying my people. I can't keep burying young people.
In Doomadgee, young people are dying from a disease that all but disappeared in the rest of Australia decades ago, without getting the health care they need.
If that was a white kid in middle-class Sydney, there'd be an uproar, okay? But it's not a white kid, it's an Aboriginal kid living in the bush. Does that child deserve any less than a white kid living in middle-class Sydney?
We had the solutions for this over 50 years ago. Yet today, we're standing back and watching young people developing rheumatic fever and rheumatic heart disease and dying from this.
Australia needs to know about this.
Tonight on Four Corners, we investigate how the deaths of young women in a remote Aboriginal community highlight a shameful and until now hidden failure in public health. Doomadgee's cemetery is full of the graves of children and young people. One of them was little Naylor Walden. 4-year-old Naylor died in 2009 with rheumatic heart disease.
She's gone, but never be forgotten.
You still think about Naylor?
Every day of the week, We're a very big family and that we just fell apart.
Naylor died after being sent home 3 times from Doomadgee Hospital, despite her family's desperate pleas.
I said, look, this kid needs help and we can't help her keeping her home. And she walked in there. She walked in the hospital, in them 2 doors there. The next day, she never walked out of them.
The little girl's death led to a community outcry. But despite numerous recommendations to Doomadgee Hospital from a health department inquiry, very little changed.
I don't think Queensland Health ever listened from day one, and they're still not listening,
Doomadgee is one of many remote Aboriginal communities that have been blighted by rheumatic heart disease, which is all but eliminated in the rest of Australia.
Rheumatic heart disease is the damage to the heart valves or doors from a condition called rheumatic fever. So rheumatic fever starts with simple skin or throat infections. So this is what we call school sores or sore throats. And if left untreated, and if the child has repeated episodes of skin sores or sore throats caused by a germ group A strep, then it leads to an inflammation of the body called rheumatic fever. And if that is left unchecked, then it permanently damages the heart valves. Once you have damage to the heart valves, then that can lead to heart failure, stroke, and premature death.
Rheumatic heart disease used to be an illness that affected many white children too.
Back in the 1940s and 50s, in Australian hospitals, the main reason a children's hospital bed was occupied was because of rheumatic fever. So it was that common. During the second half of the 20th century, it really started vanishing in most of our population, largely because we had much better economic development, we had better housing, we had better medical services. What we've since discovered is that there are populations in this country that weren't benefiting from economic development, and in particular the Aboriginal and Torres Strait Islander population. And we unfortunately found in the 80s and 90s, and continuing to this day, world record rates in our Aboriginal and Torres Strait Islander population.
Well, it's primarily because of the living conditions. And despite decades and decades and decades of appeals by Aboriginal leaders and Torres Strait Islander leaders right throughout Australia for our housing situation to be fixed, it hasn't.
One of the most disturbing things about rheumatic fever is that while it's virtually unheard of in white Australia, it's actually increasing in the Indigenous population, from 67 to 81 cases in 100,000 people. But that's nothing compared to Doomadgee. A screening of the children here in July 2019 found 4,400 cases in 100,000 people. That's higher than sub-Saharan Africa.
We're failing our people, our First Nations people, the oldest living cultural group in the world, and we're allowing this to happen at the highest rates of RHD in the world. It is an appalling statistic in a country as capable and competent as Australia.
Dr. Bo Romani is a paediatric cardiologist. She spent her first year as a doctor at Doomadgee, where she was shocked to see young people dying from rheumatic heart disease.
You can see your heart pumping and squeezing all the blood around your body. From that moment on, I had this desire to become a paediatric cardiologist, specifically to stop young children dying from a preventable disease, rheumatic heart disease. Would you like to hear your heart beating?
Yes.
Okay, if you put this in your ear and you can have a little listen. And put that in your heart here. Good job.
Dr. Bo became so famous in her field, she was named Northern Territory Australian of the Year.
So this is Bo Romani. Very nice to meet you. And her partner, welcome. Chris.
She was celebrated for her work with children in remote Aboriginal communities with rheumatic heart disease. One of Dr. Bo's first patients when she started out in Doomadgee was a baby called Yvette Booth. Everyone called her Betty.
In year 2001, I used to see Betty almost on a weekly basis. She was a young girl who was born slightly prematurely, and because of that, she had frequent presentations to the hospital.
Betty Booth was a much-loved member of her family and her community.
She was really, really happy little girl. Good to talk to. She really loved talking stories, you know, sitting with us.
It was Dr. Bowe who diagnosed Betty with rheumatic heart disease in 2019.
And I hadn't seen her since she was a one-year-old baby. It was very unfortunate in a way that I was so excited to see this family, but after doing the heart scan, we very quickly realised that Betty had very severe rheumatic heart disease.
Dr. Bowe's team left detailed instructions for Betty's care, and Doomadgee Hospital was advised of her diagnosis. Betty was supposed to be booked in for urgent heart valve surgery. She was meant to be reviewed weekly. Neither of these things happened. Four days after her diagnosis, at 11 p.m, Betty Booth came here to Doomadgee Hospital with a terrible cough. It was the first of her 12 presentations to the emergency department, with things like difficulty breathing, an abnormally high heart rate, fever and coughing up blood. She was given Panadol and, on one occasion, antibiotics. But there was no record in her notes at the time that she had a serious and life-threatening illness and required urgent heart surgery.
How many times can you present to the clinic with the same symptoms, progressing symptoms, coughing up blood, short of breath, tachycardia, and each time the outcome is not different?
I can't explain that. I mean, you know, it's incompetence as far as I'm concerned. Absolute incompetence and inexcusable.
On some of these visits, in the middle of the night, staff didn't record basic vital signs observations. And sometimes Betty was handed Panadol through a security grate and sent home.
We know that it's really not the right treatment, but unfortunately Panadol's easy to give out, so you know, people will get the Panadol and will say, oh, that's the shut up pill.
Betty's cousin, Clennon Bob, and his wife, Marilyn, were staying with Betty's family when the teenager became desperately ill in September 2019.
She was struggling to breathe, you know. She had a shower and her sister Paula took her up to the clinic, hospital. But, you know, like all this part of her face, it was swollen.
Swelling can be a warning sign that a rheumatic heart disease patient is in serious trouble. This was Betty's 11th visit to Doomadgee Hospital in under 2 months. So she took her up again to the hospital?
Yeah.
What did they do?
They gave her a Panadol.
Sent her home?
Yeah, sent her back home.
So if I present to an emergency department and I've got serious symptoms, I don't want to be handed Panadol through the grate. I want a full triage and I want to have all the work done that any other Australian has a right to expect. That is not happening for our people.
A day later, on the morning of Monday, September 23, Weenie and Terence George were out on their veranda when Betty came around. Their daughter Shakaya was Betty's best friend.
She was looking a bit puffy in the face. Yeah, she was breathless talking to me and Terence.
And I told her, you look sick, Baba, you better go to the hospital.
At the hospital that afternoon, there was still no alert on its online system to show Betty had severe rheumatic heart disease and required urgent surgery. Several hours after Betty arrived, struggling to breathe, staff finally decided she should fly out. but she was categorised low dependency, meaning her case wasn't urgent. A plane was ordered from Townsville, 850 kilometres away, instead of the closest regional hospital, Mount Isa.
I was there at the time. It was just like waiting outside. I wanted to go in and see her. No one would let me go in, even the nurse or doctors.
Just over an hour later, Betty was dead. The plane that had been ordered to fly her out landed almost 2 hours too late.
It broke both of our hearts. Still today, talking about it, we don't like talking, but this is gonna help her, because what they did there, they're just gonna keep killing people. They're gonna keep killing them and get away with it.
The next time Dr. Beau Romani visited Doomadgee was for Betty Booth's funeral.
To see Betty, who was a young, enthusiastic, caring, compassionate young woman with a bright future, to see her in a coffin, devastating. I felt angry. I felt angry that in 20 years, nothing had changed. I became a paediatric cardiologist because I wanted to stop young women, specifically, dying from rheumatic heart disease. I felt, when I diagnosed Betty with rheumatic heart disease, I felt really positive. I felt like I could change her trajectory of her life. Now, seeing her in a coffin 3 months later, less than 3 months later, I felt responsible.
After Betty's death, the community marched to the hospital in anger.
We didn't want that to happen to the next person, you know? That's why I wanted to do something like that, you know? Let them know we are, you know, we are human beings.
Who stand back and watch children time after time again, year after year, decade after decade, still having the same end result, which is dying far too young.
Queensland Health promised another review. It was completed in March 2020 and found clinical risk and poor clinical governance, low expectations for Aboriginal patients' health, and an unwelcoming hospital environment where staff had limited understanding of rheumatic heart disease. The family wasn't told about these findings until August 2021, after Four Corners started making calls about Betty.
What do you think it shows about the way that they think about the family, given that they didn't show it to the family for a year and a half?
Because they said, oh, there's another black fella gone. Who cares? I'm gonna waste time. That is the true honest. That's how we feel. That's a straight out answer. They didn't care. I'm not ashamed of saying it. We feel like they treat us like animals.
That's a big thing to say.
I'm sorry, but not really sorry, but it's the truth.
It's racism. There's no other words for that. It is racism that creates this division. One group of people thinking potentially that they're better than the other.
The town of Doomadgee was established as a Christian mission in the 1930s. It was run by paternalistic Brethren missionaries.
And the disciples watched, they wondered what Jesus was going to do.
These 5-year-olds, tribal Aborigines, are constantly reminded that Jesus loves them.
That Jesus was going to wash their feet.
When the missionaries moved away in the 1980s, they left behind a community in extreme poverty. That hasn't changed.
We've got families all living in 3-bedroom homes, which, you know, is certainly not adequate to house that many people. You got people sleeping outside on the verandas, or people, in tents. All these people use the same facilities, the same toilet, the same wash bowl, the same showers. So therefore, if there's an infection in the house, it's going to spread amongst the family.
People will say, oh, well, Aboriginal people choose to live like that. But it's not a lifestyle choice. We don't want to live overcrowded. We don't want to live where our house is falling apart, where we can't get repairs on our house.
There are massive issues with what we call health hardware, just the basics of a working fridge, of a working shower, of a flushing toilet, of having access to a washing machine, that many Aboriginal communities, many Aboriginal households don't even have those basics.
Governments have been promising for years to solve these problems.
And to draw a line in the sand to say today is a day that we've got to start that journey is important.
The federal government has committed to eradicating rheumatic heart disease in Aboriginal Australia by 2030. A report commissioned by the government predicted it would cost $4.3 billion, mostly to replace poor housing. But the money largely hasn't materialised, except for $35 million for development of a vaccine, plus $25 million for a register of patients.
The government has failed on that commitment, and disappointingly for Aboriginal and Torres Strait Islander people, it's not the first time any government's failed, but we're getting tired of it, Louise.
So the frustrating thing is that we have a commitment to doing something serious about rheumatic heart disease and all the elements in place to control it, yet the funding has remained absolutely static.
The federal government's Minister for Indigenous Australians, Ken Wyatt, and Health, Greg Hunt, declined to be interviewed for this program. The Queensland Health Minister was unavailable due to the state's floods, but told Four Corners she's about to announce a $7.3 million rheumatic heart disease strategy. Decades of policy failures by governments have had devastating consequences for children growing up in Doomadgee. Nearly 2 years ago, Tamisha, Alicia and Simona Sandy lost their mother to rheumatic heart disease.
She was very fun, kind, beautiful. Always a storyteller, tell us a lot of stories.
The girl's mum, Adele Sandy, died 8 months after the death of Betty Booth.
It's really hard trying to forget about her because it's really hard. It's not easy, especially with the weight that I have to hold for these two. It's pretty heavy.
Alec Doomadgee was Adele's older cousin. Adele was diagnosed with rheumatic heart disease when she was little.
The earliest I can remember of Adele being, I guess, starting to feel sick was she would have been around 6 years old or whatnot. And Mum Eunice, her mother would always tell us that, she wasn't well, there was something wrong with her. And we were told in the spirit world that the spirit being called the Gurrajala had shadowed her and put a hole in her little heart.
In the middle of May 2020, when she was 37, Adele fell seriously ill. Her mother, Eunice, was very worried.
She was walking in Bendy Way, and every time she comes to me, she says, "Mom, I'm sick. I'm feeling heavy in the chest and I can't drive."
Adele's sister, Chaslin, says she repeatedly brought Adele to the Doomadgee Emergency Department and asked staff to fly her sister to a bigger hospital.
I asked them twice. I took her in about 4 times before she stayed in, but at that 4 times I took her in, they didn't keep her in overnight, like they was just giving her pain tablets and sending her home. It's very awful the way they do that to Aboriginal people. I tell you now, I'm that frightened to go to the hospital, I don't go there. Because they don't attend to you or say hello to you, and ask you what you want. Yeah, or what can they do for us, they don't say that. They are very rude.
Why do you think they treat the people in this town like that?
I think because we're Aboriginals. Yeah.
Over the next couple of weeks, Adele Sandy's family saw her suffering from excruciating pain and swelling in her legs, a known sign of heart failure. It became unbearable. She went by ambulance to Doomadgee Hospital and staff kept her in for 2 nights before discharging her again. Adele's hospital records suggest that at critical stages of her care, some of the most basic checks required for rheumatic heart disease patients weren't done. The notes claimed she had no edema, meaning no swelling. Her entire family disputes that.
I told him this is not normal, her leg is swollen, and one of the nurses said, "Looks normal to me, it doesn't look like it's swollen."
So those notes aren't true?
Yeah, they ain't true, because I've seen it myself. I know my wife,
On Saturday, May 30, Adele Sandy awoke at home in pain. That afternoon, her husband called an ambulance.
I told her it's going to be okay, but little did I know that it wasn't going to be okay.
Adele's mother, Eunice, wanted to see her daughter, but she says she and her sisters were locked outside the hospital in the baking heat.
Her daughter's fighting for her life at this stage. She wasn't allowed to enter the hospital. She wasn't allowed to sit beside her bed. And the old ladies, these are old Aboriginal women. These are old, very well-respected tribal law women in Doomadgee. They weren't even afforded the luxury of sitting inside in the air conditioning building. They were told to stay outside. They weren't even allowed in the waiting room. They sat there and couldn't even use the toilets.
I felt like an animal, mate, hanging around the door for my daughter. I was like that horse that come here hanging around the door for my father. And they wouldn't let me in there.
Eunice and her sisters wanted Adele flown out for emergency care. They called Eunice's nephew, Alec Doomadgee.
They just started crying and said, "You need to do something. Your little sister, Adele, is going to die if you don't get her out of Doomadgee."
But it was already too late.
You know, I remember them just going in there and they was trying to revive her and they said, it's been 10 minutes, we're going to keep going and for another 10 minutes. And the doctor said it doesn't work, you know, she's gone. And I didn't know what to say, didn't know what to say to anyone then. I was just crying, you know, and trying to talk to her, trying to tell her to wake up. But yeah, she couldn't wake up.
When the police officer came out and told me and my other two sisters, we just fell to the ground. I was in darkness. I cried till I couldn't cry out no more. I just lied there in people's arms. They just come along and nursed me. I stayed like that till next morning.
What happened to her it shouldn't happen to anybody. You know, it's human life. She should have been treated right as a human being. But she wasn't treated like a human being.
How do you feel about Doomadgee Hospital since then?
I don't go to that hospital. I suffer with toothache. I don't go. Mum told me to get the needle. I'm frightened to get that. I don't go to the big hospital anymore.
Why do you think that Aboriginal patients are continually being treated in this way when they present to hospital?
I'd have to say it's discrimination and racism. What else can I put it down to? I mean, seriously, why should our people be treated like this? You know, it's not fair, it's racist, it's unacceptable in Australia, and we're not going to cop it anymore.
When Adele Sandy was buried in July 2020, among the mourners was 17-year-old Shakaya George. Shakaya had, the year before, lost her best friend, Betty Booth, to the disease. Shakaya had rheumatic heart disease too.
She was really special, and she was just full of life. She had this smile that could just light up a room.
Shakaya was diagnosed when she was 8. She'd twice had open heart surgery.
If we should go to sleep, we'd listen to the little tick on her heart. No. And we'd tell her how special she was to have that little tick inside of her. So the little tick of the artificial valve would be tick, 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 tick.
In the weeks before her Auntie Adele's funeral, Shakaya had become seriously ill while travelling in the Northern Territory. She was admitted to Alice Springs Hospital, where her notes show Shakaya was breathless, had fever, chills, a cough, and was vomiting. Tests showed she had damaged heart valves and swelling in the lungs.
She was all swollen in her body, her legs were starting to swell, starting to get breathless, short of breath.
Despite having been in heart failure for weeks, Shakaya was discharged from Alice Springs Hospital to drive to Doomadgee, with a letter saying she needed to see a cardiologist. But on the way, she fell ill again and was admitted to Tennant Creek Hospital. Once again, she was discharged.
And I was like, okay, should they fly her out to Adelaide straight away? I reckon, no, they're releasing her so we can drive her back to Doomadgee. I was kind of a little bit concerned. I was like a bit shocked.
By the time Shakaya arrived at Doomadgee, she was gravely ill.
And on the Friday night, I get a phone call from Weenie saying, you know, Shakaya's really sick, she's not well. We've gone to the hospital and they just sent us home with Panadol. There's a history and records at Doomadgee, at the hospital, around who Shakaya is, what her records are, what she needs. And just remember, they've also had the issue with my sister Adele only 2 months ago that presented with the same similar I guess, signs of rheumatic fever, you know, the swollen legs, the breathing, you know, the elevated heart, all the issues around that show that she was in dire straits and needed medical help straight away.
They actually gave her Panadol as well. And I just walked out and I didn't want her to sit in there. I didn't want to listen to how they acted and wanted to treat her. They made me so angry I didn't want to listen to the words.
The family gave up on Doomadgee Hospital and drove 100 kilometres to a clinic at Burketown. From there, Shakaya was flown to Mount Isa Hospital and then on to Townsville. At Townsville Hospital, she waited for 8 days to fly to Brisbane, where she could have surgery.
We was actually begging the doctors to, you know, and asking them what time does the plane comes in. It took maybe a week or two, you know, and we just kept on begging them. They keep on ringing and they were saying the plane was elsewhere flying.
By the time she got to Brisbane, she had been in almost 6 different hospitals. You know, Alice Springs, Tennant Creek, Doomadgee, clinic in Burketown, Mount Isa, Townsville, now Brisbane. And this whole time, the whole period, she'd been in heart failure. So I got to Shakaya literally the night before she went in for her surgery. And that was the last conversation I had with her. I told her that she was going to be safe and she was going to be okay, and that the spirits would be with her.
They said it was going to be okay. The doctor told me. They all told me. She's only going in and coming out. That's all they said.
But it wasn't okay.
After surgery, Shakaya went into multiple organ failure.
She went right down. Everything just failed. Her kidneys, her liver, lungs.
By the time I got to her, her brain was dead. That little sick heart of hers was really big. It was a really big heart. She had so much love to give.
On the 12th of September 2020, the family said their goodbyes. The life support machine was switched off. Shakaya died 3 months shy of her 18th birthday.
The system failed her. The health system failed her. And if I don't speak for her now and I don't tell her the story, it's going to fail somebody else again really soon.
Late on Friday, the day after being contacted by Four Corners, the Queensland coroner announced an inquest into the deaths of the 3 women. Queensland Health Minister Yvette D'Arth told Four Corners in a statement the women's deaths were tragic and clearly the patients have been badly let down. She says she expects any allegations about the standard of care at Doomadgee Hospital to be investigated.
There's a lot of wrong things happen in the hospital that a lot of people lost their lives. We got to get up, we got to stand up and start saying something, otherwise it'll keep happening to us.
Adele Sandy's husband, Edgar, has formally complained to Queensland's Human Rights Commission, alleging racial discrimination by Doomadgee Hospital.
I think that they didn't think that I'll take it this far, you know, go to Four Corners, get a lawyer, you know, because if I didn't do this, you know, who knows what they would have been doing after this. They probably would have been just doing the same thing, you know, like not treating our people the right way. We need to be treated just like everybody else. Yep.
I don't think I'll forget about Adele.
How could you?
I can't. I can't even talk about her with a bit of little tears rolling down my eye, even if I go to say happy birthday or her death anniversary or burial day.
I sing out a lot to them girls. I sing out to them. I just mistake sing out her name. Think she's with us, yeah. She's always be with us.
Betty Booth's sister, Denise, visits the graveyard every day. She was diagnosed with rheumatic heart disease the same day as Betty. She's 19.
It's like we miss her and that. Miss her ways and everything, her smiles and that. And yeah.
And them kids, they want to have a future. They're not helping us. They're killing us. They're not helping us. They don't care about us. They don't. If they did care, Betty would have been still here. Shakaya would have been still here.
Adele
would have been still here.
Governments are... Our federal government has the power to change this. They are the only people. Our Prime Minister has the power to put an end to this. We're not asking for something fancy. We're not asking for something magic. We're asking for delivery of the health solutions that have been known to mainstream Australia for over 50 years.
Our children are having open heart surgery. Our children, 4 years old, 8 years old, 12 years old. And then they're expected to go back to a remote community, live in overcrowded conditions without the range of support services. You know, I mean, it's just, if that was a white kid in middle-class Sydney, you know, there'd be an uproar, okay? But it's not a white kid, you know, it's an Aboriginal kid living in the bush. Does that child deserve any less than a white kid living in middle-class Sydney? No.